Hi, my name is Dr. Lee. I would like to thank all of you for taking the time this evening to attend this webinar. Just to provide you with a little background about myself, I'm a board certified internist with over 30 years of experience. I'm also certified in functional medicine. When I work with my patients, I will take a functional medicine approach. If needed, I'll also use conventional medicine. In fact, I believe that's the advantage of seeing me, somebody who is trained as a conventional physician. I will take the best from both approaches and merge them. Sorry, I'm just trying to advance the screen here. All right. So, what I'd like to do is I would like to use a discussion of irritable bowel syndrome as a template for how we can restore gut health. So, what exactly is IBS? IBS is irritable bowel syndrome. It's a chronic gastrointestinal order, and it is characterized by a host of different digestive dysfunctions, such as frequent abdominal pain, gas, bloating, indigestion, constipation, and diarrhea. The symptoms and levels of severity can vary greatly between individuals, but this digestive order can be very disabling. So let's talk a little bit about um, functional and what is a functional gastrointestinal order. IBS is classified as a functional gastrointestinal order because although our the patient with the IBS, the digestive system isn't functioning properly, when we run conventional labs and tests, they tend to be normal. And that's the definition of a functional illness in conventional medicine. So there are many diseases in conventional medicine that are functional, but because there are no test abnormalities, a conventional medicine doctor will just give some medicines to treat the symptoms. This doesn't take care of any of the long-term health problems, though. Functional medicine doctors, however, will take the time to understand why this individual has a disease or a particular set of symptoms. And because IBS is a collection of different symptoms specific to that individual, the root cause will also not be the same for every person. So when we ignore the diversity in this disorder or any disorder, this is dangerous because we don't treat the underlying cause. When we don't treat the underlying cause, it can escalate to more serious conditions such as autoimmune disorders. Functional medicine is revolutionizing healthcare by empowering patients to better understand the imbalances in our bodies, how these imbalances affect our health, and the solutions that are available to support normal healing mechanisms within our bodies. Functional medicine differs from other medical models used today because we use a more personalized care that is specific to each individual. And the focus is on the cause of the discomfort or illness rather than just what the symptoms are. And the last most important thing we do is there's a deep seated trust in our belief that your body has the ability to self regulate. So IBS is found in about 10 to 15% of the population, but only a small percentage of people seek medical care. Studies done in the United States show that IBS is the second most common cause of missed work in the United States. It also accounts for 25 to 50% of all referrals to gastroenterologists. So, why do only a few percentage of people seek medical care? And why do only, and why is this not considered a more significant illness? Well, some of the obstacles actually to patients seeking medical care is they feel that they are written off as experiencing psychosomatic symptoms. They're also have approach when they talk to other doctors. The approach is that this digestive discomfort is quote unquote normal. And then also they may be told that there are no effective treatments in conventional medicine. It is a difficult diagnosis to make. IBS is a diagnosis of exclusion. So, in other words, we need to run many tests and find that there are not abnormalities in those tests that we run. And then, if we can't find a diagnosis, then we say, okay, well, this patient has IBS. So the issue is that there are no anatomical or structural problems that conventional medicine can readily identify. And there are no physical or chemical disorders that we find on labs. So this highlights that conventional medicine just looks at symptom management versus functional medicine, where we look to find the true root cause of the dysfunction. So, what are some common causes of irritable bowel syndrome? Just because everybody's experience with IBS is highly individualized, the initial causes are highly individual. IBS is not formally classified as an autoimmune disease, but it shares many of the same risk factors, potential causes, and complications of the inflammatory conditions we know today. Some of these include poor diet, leaky gut, and we'll talk a little bit more about leaky gut, bacterial overgrowth, yeast overgrowth, parasites, food intolerances, antibiotic use, toxin exposure, chronic infections, stress and psychological issues, hormonal issues, and genetics. And you can see that these are potentially causes of many other things other than irritable bowel syndrome. So the first thing I'd like to talk about is leaky gut. And this is something we talk about a lot in establishing a healthy gut microbiome and a healthy gut. So what is leaky gut? Well, normally the cells in our gut are very tightly adjoined to one another. So if we have any foods or nutrients in our digestive system to get to the bloodstream on the other side, the cells, the colonocytes, really decide that these particular components are going to end up in the bloodstream. However, if there is leaky gut, there's space between these cells, and molecules and other things can diffuse over easily between the cells to the bloodstream on the other side. And then these substances, or we can call them antigens, when they end up in our bloodstream, can cause a myriad of problems. Many of them are autoimmune problems because our body is not supposed to be exposed to these things or so many of these things. So, what can cause leaky gut? Well, food intolerances, infections, stress, age, many other things. These are factors that can affect the gut's permeability and integrity. So, how do we take care of a leaky gut? Well, the best way is to participate in a functional medicine gut restoration program. And we'll be discussing these healing tactics a little bit later on in our presentation. And so, I am talking about IBS, but I'm actually talking about having a healthy gut, whether it be IBS or other issues going on in our digestive system. One thing that we like to look at in patients with leaky gut or with other digestive problems is something called SIBO. SIBO stands for small intestinal bacterial overgrowth. And about 80% of patients with IBS actually have SIBO. So, what is SIBO? SIBO is when we have too many bacteria in the small intestine. When we eat food, food starts in our mouth and then it goes to our stomach and then it goes to our small intestine. We break down a lot of things and then it goes to our large intestine where the bacteria is, and the bacteria break down the food further. However, if the bacteria migrate up into the small intestine, it can cause a lot of symptoms. This condition is often fueled by diets that are heavy in sugar, alcohol, and refined carbohydrates because the bacteria like to feed on these things. If we use antibiotics, any acid blocking drugs, steroids, this can also cause issues, and so the patient can develop SIBO. How do we diagnose SIBO? We use a breath test. And this test will provide us information on the bacterial activity in the body and then will give us an idea of the best treatment protocol that we would use to treat SIBO. So yeast. Having a yeast overgrowth is very similar to SIBO in the sense that it causes many of the same IBS symptoms, such as bloating, gas, constipation, and diarrhea. Instead of bacteria, however, it's yeast or fungus that is overgrowing, that is in response to the imbalance in the gut flora. The most common form of yeast overgrowth is Candida. Candida is a kind of fungus that is naturally present in our mouth and intestines, and it aids in digestion and nutrient absorption. However, if there is too much Candida, then we can end up with issues where we have a breaking down of the intestinal wall. That's a common characteristic of the leaky gut complications. Then we get a variety of health problems, specifically IBS symptoms. So, as I said before, Candida likes to feed on sugar. Well, most of the American population is at risk because we have a very large amount of sugar that we take in our diet. We can test for these yeast levels through blood, stool, and urine testing. So, what are some other things that we look at? Parasites. So, parasites are a lot more common than most people think of. Since these parasites are usually ingested, the most common problem they cause is a digestive damage and compromising our absorption of nutrients. Unfortunately, the healthy bacteria in our gut are not always strong enough to defend against the parasite's rate of reproduction. So, long story short, parasites can be directly harmful, and we often need to take additional means to eradicate these organisms and the potential damage that they can cause. Food intolerances, allergies, and sensitivities. These can all contribute greatly to significant digestive distress, like we see in IBS or with other gastrointestinal issues. So these particular food intolerances, allergies, and sensitivities can be very hard to detect for a number of reasons, including you may be allergic or intolerant or sensitive to more than one particular food. We can do elimination testing, but this does take a significant amount of time. And not everybody reacts the same to these food sensitivities. So we may have different symptoms, which may or may not be due to these intolerances, allergies, and sensitivities. So these symptoms can be easily misinterpreted. There are several ways to test for this that we have if you're suffering from a food allergy intolerance. One of the ways we do this is with IgA antibodies. So IgA, or immunoglobulin G, is the most abundant antibody in our human body. It is found in almost all the body fluids, and it works as a protective mechanism against bacterial and viral infections. So when we test for these levels of IgG, this can be an incredibly helpful tool for us to indicate if there's any adverse food reactions. When we do this testing, we also can include something called complement testing in the antibodies. It just depends on, when we meet with you, we will decide what test is the most appropriate for us to be using for you. So, what is an elimination diet? Well, basically, with elimination diet, what we will do is we will be eliminating foods that might be sabotaging your health. And then, when we eliminate them, we can see how you feel. So, this elimination diet takes about 3 weeks to first start. And what we do is we eliminate the foods, and then we wait for about 3 weeks to see whether the symptoms start to go away. So what we want to do is we want to bring your body to a blank state diet-wise. And then you can slowly reintroduce each food individually. This will give us an opportunity to recognize really what foods are giving you what symptoms. So the most common foods that tend to cause us problems, I mean, not just in terms of IBS, but other illnesses, are dairy, gluten, soy, corn, eggs, refined sugar, peanuts, red meat, alcohol, caffeine, and processed foods. There are foods, though, that are fine to eat on the elimination diet, because sometimes, I'll mention elimination diet and go over those foods, and the patients will say, oh, well, then what can I eat? It seems like there's not much left for me to eat. But actually, there's a lot of foods that are available. Gluten-free grains such as rice, quinoa, tamarind, tapioca, buckwheat, teff. There's a lot of dairy substitutes: almond milk, coconut milk, hemp milk, rice milk. Most vegetables are fine to eat, definitely not corn, but all other vegetables are fine. Whole fruits are fine on this diet. They can be fresh or frozen. You can eat lean or clean animal protein. Wild game, lamb, organic chicken, fresh fish are just some examples. Nuts and seeds are fine on this diet. Beans and most legumes are fine on this diet. I mean, except, of course, for soybeans and peanuts. Any high quality oils are fine to cook with on this diet. You can use coconut oil, avocado, cold pressed olive oil. You can drink herbal teas on this diet. You can work with our health coach, and she will really spend a lot of time with you going over in detail how you can set up an eating program and cook a diet program that will incorporate foods that are fine to eat in the elimination diet that you tend to like to eat. So when somebody does an elimination diet, what are the do's? What are some of the do's and don'ts? Well, When you start reintroducing food, it's very important to pay attention to how each food makes you feel. So basically, what we do is you've been on the elimination for diet for 3 weeks or 4 weeks or however long we feel is necessary for you, and you're feeling much better. Then you will introduce one set of foods. So you pick this one food and you note how it makes you feel over the next 2 days. If you feel great, then we add another kind of food in. And gradually, slowly, we start introducing the foods and find out really what foods are causing you symptoms. If a particular food causes you a symptom, we have you stop that particular food. And then we wait until the symptoms go away completely before we then try to reintroduce another food. The important thing about an elimination diet is it does take a while to do, and it's important to allow enough time to both eliminate and reintroduce foods so that we can really get most accurately ascertain what's causing you symptoms and what's not causing you symptoms. So, what are other things that we do to help restore your healthy gut? Well, there are the 4 R's, and some people would even say that there are the 5 R's in a gut restore program. So, what are these R's? Well, the first thing is we remove things. So, what do we remove? So, we remove foods that can potentially cause a problem, any toxins, low-grade infections, things that can cause what we call oxidative stress in our body. The second thing that we're going to do is replace. That's our second R. So what are we going to replace? Well, things like digestive enzymes, hydrochloric acid, bile salts, fiber. So how do we decide what we're going to do? Well, we're going to do some testing. And then based on this testing, we know what things we need to replace. The third thing that we're going to do, the third R, is we're going to re-inoculate. So we're going to use some kinds of pre and probiotics. We're going to repopulate your body with healthy bacteria. But we don't just use any probiotics. We need to do the testing to figure out what's the best way for us to repopulate or re-inoculate. The fourth thing we're going to do is repair. So we're going to use different nutrients to repair, some vitamins, some minerals. We're going to use things that are going to help improve the mucosal lining and different antioxidants. And how are we going to decide what to do? Well, this is going to be based on testing and your particular set of illnesses or symptoms. The last thing we're going to do is rebalance. And this is the newest step that we've introduced. So what are we doing when we rebalance? Well, we're providing support so that your body is able to undergo these restorative processes. What does this include? So it's going to be mindful eating and better choices in what you eat. We will work with you in terms of heart rate variability and biofeedback. Things such as yoga, meditation, breathing, many kinds of centering practices will help our body rebalance. Even things such as therapy, which we could, sometimes suggest you get certain types of therapy. It could be psychotherapy, it could be craniosacral therapy. There's many different other supports that we have that will help in restoring gut health. So I'm often asked about, so what do we do with probiotics and prebiotics? What are these? What is the difference? Why are these important in terms of gut health? Well, probiotics are live bacteria, excuse me, that help us promote a healthy balance of bacteria throughout your digestive tract, what we call the gut microbiome. So these kinds of probiotics can be found naturally in foods such as yogurt, kefir, sauerkraut, tempeh, miso, kimchi, kombucha, but also we will prescribe particular probiotics depending on your underlying condition and test results. And then prebiotics are a kind of plant fiber, and they act as, you can think of it as a fertilizer or food for the bacteria in our digestive system. So the way we look at this is prebiotics are needed for probiotics to thrive or grow within our digestive system. And prebiotics are found in foods. You can think of foods, many of our vegetables, okay? Artichokes, garlic, onions, asparagus, or in some of our grains, and wheat and apples, legumes. So there's many things that have prebiotics. And there's times that we will use these, and there's times that we'll prescribe prebiotics for you. Digestive enzymes. So I'm often asked about, do I need to use digestive enzymes? Well, that's something that we can find out when we do testing. What are digestive enzymes? These are produced in our pancreas, and then they help us break down foods and proteins, and they also aid in nutrient absorption. Okay. Then what other supplements do we use? Well, sometimes we'll use fiber. Sometimes, however, we'll wait on fiber because sometimes giving fiber can worsen things until we can improve some other underlying things. We may be using some B vitamins. We may recommend fish oil, magnesium, other vitamins like vitamin E. We might want to use something called glutathione, which is our master antioxidant. Sometimes we use melatonin. Sometimes we use EGCG, which is actually found in green tea. We might use peppermint oil. You know, of course, everybody's needs are very different. So it's important for us to do the testing to find out what it is that you need to help bring you back to health. It's important for us to do certain kinds of detoxification. We are exposed to a lot of toxins in our environment, in our food, and that can affect the health of our gut microbiome. That can affect our hormones. It can affect many things in our body. And when we see you, we will determine, if you need detoxification and what kind of detoxification you need. Oftentimes, that's an important step in restoring gut health. And last but not least, we need to make sure that, for example, when I talked about the last step of the 5 R's, our mental health is very important. All right. So it's all interrelated. Our brain health, our mental health, our physical health is all related. So those are important things also to look at, not to just to say, oh, you have an imbalance in your gut, I'm going to give you this pill. It's not just the pill. So I'd like to thank you all for taking the time to come to this webinar. I can answer